Good afternoon, everyone, and welcome to our fifth annual Social Return on Investment webinar. As Donna indicated, I'm Lori Chapman, and I'm the president of Enterprise Community Loan Fund. I've been with Enterprise for close to 12 years, and I'm thrilled again today to be here to formally launch the rollout of this year's Social Return on Investment report. For those of you joining us for the first time, as the issuer of the Enterprise Community Impact Note, annually, Enterprise Community Loan Fund hosts a webinar to highlight the impact and social returns of your investment as documented in that report, the Social Return on Investment report. Today's webinar will provide an overview of the findings detailed in this year's report and how your investment in the Impact Note played a critical financing role for creating homes that are affordable to families and individuals that were formerly homeless or otherwise housing insecure because they were paying more than a third of their income on rent. In a few moments, I'm going to turn the webinar over to Lindsay Dower and Aaron Buckley from our Knowledge, Impact, and Strategy team, who over the last few months conducted the research and documented the benefits of the investment in two developments, our investment in two developments. The first is CAMBA Gardens in Brooklyn, New York, and the other includes two different pieces, the Stout Street Health Center and Renaissance Stout Street Lofts, both in Denver, Colorado. These investments are unique in that they integrate on-site access to healthcare services with a home that's affordable, and today we're excited to share the outcomes realized by residents, patients, and society as a whole as a result of these investments. Before I turn it over, I want to provide an overview of the Impact Note and how your investment through the note helps expand opportunity for low-income people throughout the country. Enterprise Community Loan Fund's note serves as a way for socially motivated investors to support our work. Since we launched the Impact Note in 2010, more than 300 investments have been made from a wide variety of investors, providing over $55 million for communities and people in need of an investment. Excuse me. Investors in the note receive both a financial return and also make an impact in the communities where their money is invested. This is our social return on investment. To truly report back to you on your social return, we wanted to talk with residents whose lives have been changed for the better, thanks in part to investments made by the note investment and through the loan fund. We also want to gather information about how these projects came to fruition so that we can learn from their success. The type of capital we provide is unique because we step in where typical financial institutions otherwise will not. Due to our relationships with local stakeholders and our expertise in underwriting community development projects, the loan fund is able to properly assess risk and provide very early stage capital like pre-development loans and acquisition financing that bridge to ensure that these high impact community projects in fact do come to fruition. We've been doing this work for more than 20 years and have invested more than $1.3 billion in capital to support nearly 100,000 affordable homes. The stories we're about to share get to the social return on investment, how your dollars invested through the Impact Note are supporting projects like these and positively affecting the lives in need throughout the nation. We like to say that the Impact Note provides a double bottom line return for investors, a financial return through payments of interest, and a social return through the impact your dollars leveraged while supporting our mission and work. And now I want to turn it over to Lindsay from our Knowledge and Impact Strategy team to speak more about the work at CAMBA in Brooklyn and the Stout Street Center and Lofts in Denver. Lindsay?
Thanks, Lori, and hi, everyone. Thanks for joining us today. We're excited to talk with you a bit about some of the positive impacts that we saw in these two developments, and there's a lot more in the report that we can't fit into this webinar, so we encourage you to read through that to hear more. As we were looking at these two projects, we leveraged both qualitative and quantitative information with the goal of really understanding how people's lives have positively changed through these projects and how it affects the broader community as well as the economy. And so as we were pulling this research together, we used economic analysis. We also used resident stories, doing a lot of interviews firsthand, as well as interviews with the development team and those that were working on bringing these projects to fruition, as well as looking at the existing evidence base and other research that has been done on similar projects and pulling in what we already know about similar projects and what they're able to contribute to residents' lives as well as to the economy. And so we pulled all that together in this report, and we also highlight lessons learned through the development process, as well as some of those key success factors that really helped bring these projects to fruition. And so we'll touch on some of those during the report or during this webinar, and they're also featured in the report in more detail. And as Lori mentioned, these two projects that we're looking at, CAMBA Gardens and Stout Street, have a broad reach. Combined, they provide 287 new homes for low-income and formerly homeless households, and the health center serves more than 13,000 patients each year. As we were looking at the impact, it really touches on a variety of different places within people's lives, and so we categorize that into these three categories: housing security, which also relates to their stability and their ability to stay in housing, the economic impact on the residents as well as on the local community and the economy, and then health and wellness. And so the first project that we're going to look at in depth is CAMBA Gardens. Was developed by CAMBA Housing Ventures, and it's the first phase of a two-phase project. CAMBA Gardens 2 is currently under development. CAMBA was founded in 1977, and it helps vulnerable New Yorkers enhance their quality of life by providing comprehensive services. As New York's housing crisis became more persistent, CAMBA launched CAMBA Housing Ventures in 2005 to develop high-quality, affordable homes to really meet the housing needs of those people that they serve. So far, CAMBA Housing Ventures has created over 800 homes and 7 properties, and there's an additional 1,237 homes that are on the way. And all of these properties are staffed with case managers and incorporate other CAMBA services to really provide comprehensive services and supports for these vulnerable residents. Before looking at the impact of CAMBA, it's really important for us to look first at the local context and the need that this project is meeting. I know that you're all familiar with the idea of New York City as a high-cost market, and this problem has become more exacerbated over the past few years. In Brooklyn in particular, where CAMBA Gardens is located, the income growth has not kept pace with the rise in median rent. So this places an increasing number of families at risk for housing insecurity and homelessness. A lot of them are spending more than half of their income on rent, which really creates a lot of problems for these families. And in fact, the number of people that are living in New York City homeless shelters has increased by 161% over the last 15 years. So in 2015, there were 75,000 homeless people in Brooklyn. 27,000 of them were children, and of the total, 15,000 were actually living on the street with no shelter at all. And so it's in this context that CAMBA Gardens is really meeting this really crucial need. And the development is the result of an innovative partnership between the New York Health and Hospitals, the Public Hospital Agency, and CAMBA Housing Ventures as a nonprofit affordable housing developer. And so Health and Hospitals approached CAMBA Housing Ventures and wanted to talk through the idea of reusing some underutilized land on the hospital campus for supportive housing. And so through this partnership, CAMBA Housing Ventures now has a 99-year lease on the land, and they were able to replace 2 of the vacant hospital buildings with CAMBA Gardens 1. And this was really a win for both sides. CAMBA Housing Ventures was able to save considerably on land through this partnership because they didn't have to face private market competition for the land. And Health and Hospitals was able to avoid having that upkeep cost for those 2 vacant buildings, and it also removed that vacant blight. The additional benefit for the hospital is that 15% of these units are reserved for low-income hospital employees, which is really a benefit in this high-cost market. And the last piece of financing to mention here is that Enterprise also served as a syndicator on the development for over $26 million in low-income housing tax credit investment. And so the development itself provides 209 units. 146 of these are supportive homes for the formerly homeless, and 63 of the units are for families and other low-income households. And just to give you a sense of what that low income means, for a family of four, it would be those making $54,000 or less annually, which is really stretched quite tight when you're thinking about the New York market. The location is close to the rest of the city, so they're connected by bus and metro. Midtown Manhattan can be reached in 45 minutes on public transit. And also being on site of the Kings County Hospital enables residents to access health care right on site, as well as there are numerous other physical and mental health care providers in the neighborhood, so that residents are really able to quite easily access health care. And so now I'm going to transition it to my colleague, Erin Buckley, who's going to talk more about some of the impact that we saw with this development.
Good afternoon, everyone. At CAMBA Gardens, the 146 chronically homeless residents receive individualized case management, and that assists them with things like adjusting to having a home, managing their finances and paying rent, to managing their healthcare needs, or assisting with personal development activities. With the assistance of these case managers, 94% of CAMBA Gardens residents have remained stably housed since moving in. This housing retention is important because it results in savings on expenditures on public resources. Chronically homeless individuals typically have the highest and most costly needs. One study found that chronically homeless individuals who utilized healthcare, shelter, and jail facilities at high rates generated an average of $36,400 per year in public costs in New York City, compared to only $20,700 per year for their peers who had housing. This creates an estimated annual savings of $15,700 per person, which would equal $2.3 million for the 146 CAMBA Gardens permanent supportive housing residents. And I want to introduce you to one of those right now. This is Serena. She spent 4 years in the shelter system with her husband, following an incarceration that stemmed from her addiction. They actually owned a condo prior to her incarceration, but her husband was ill and disabled and unable to keep it up on his own. So when she came home, they had to move into the shelter, and finally were able to obtain housing at CAMBA Gardens in 2013. Unfortunately, her husband passed away shortly after they moved in, but she says she's extremely grateful to the staff there because they helped her make arrangements after his death. She always pays her rent on time today. She enjoys caring for her apartment, and she adheres to all of her medical directives, and she feels more stable than she has been in years. She hopes that by sharing her story, she can reach other people and serve as an example. Families who spend too much of their income on housing costs are often forced to make dangerous trade-offs when it comes to paying for other necessities, like food, health care, child care, or other educational expenses. As an example, if we're talking about New York City, we're talking about this family of four who is making about $54,000 per year. When they have an affordable home, they're able to reallocate their limited resources to these other necessities. This is important for those residents in the 63 units at CAMBA Gardens that are reserved for low-income residents. And if we take an example of this family that we discussed already, living in affordable housing would save them $906 per month compared to if they lived in housing that costs something like half of their rent if they were severely cost burdened. This equals $10,872 annually, and you could put that towards something like 4 years of high school supplies and extracurricular activities for those two children, 3 years of healthy home-cooked breakfast, or 9 months of infant or child care in New York. CAMBA Gardens also has wider economic impacts beyond these savings. Over the course of the project, 81 different vendors and contractors were involved, generating revenue for the local economy. These businesses employed over 1,100 people. CAMBA Gardens also contributes 42 jobs on site and additional indirect federal and local tax revenues. This is another resident of CAMBA Gardens. This is Dwayne. He experienced a severe mental distress following an unexpected personal tragedy. He turned to alcohol, lost his job, and became homeless. For years, he lived in subway tunnels, working small jobs whenever he could, and when he occasionally got incarcerated for petty crimes, he took advantage of several job programs in prison to increase his skill set. Finally, he was connected with a homeless outreach program and found permanent housing at CAMBA Gardens. Today, he does what he can to help people living on the streets, referring them to the organizations that served him when he needed help. He believes that because he was helped so greatly, that it's his responsibility to give some of that back. He's looking forward to finally returning to full-time work now that he is feeling better and has more control over his circumstances. Chronically homeless individuals struggle to attend to their healthcare needs, in part because of their inability to pay for necessary services. But when you're living on the streets, it's also difficult to manage self-care, medication adherence, or even just to travel to and from appointments. The chronically homeless, therefore, often rely heavily on emergency care, which they cannot afford, and only when their health issues get out of hand. Supportive housing has been demonstrated to reduce the rate of ER usage for chronically homeless individuals, and this has proven true at CAMBA Gardens. A survey of 60 residents revealed a 79% reduction in the number of residents reporting 3 or more ER visits the year after being housed compared to the year before. Additionally, 85% of residents participating in case management list healthcare management as among their goals, and 76% of these residents are achieving some of these goals. The impact of affordable housing on public sector health costs can also be large. As this graph illustrates, public sector costs in New York City have been demonstrated to be significantly larger for the chronically homeless on the streets compared to their peers who have supportive housing, especially in the area of costly psychiatric hospitalizations. This study concluded that supportive housing generates an average of $7,300 in annual public sector health costs per person. For the 146 residents at CAMBA Gardens, we estimate that this could translate to $1.07 million annually. And the final resident I want to introduce you to who lives at CAMBA Gardens is Lamora. She became homeless as a teenager and spent years living between shelters and the streets before finally being connected with Homeless Outreach again and moving into CAMBA Gardens less than a year ago. She is now able to better manage her mental health. She experienced several really traumatic experiences while she was homeless and never was really able to process them correctly when she was still struggling and living on the streets. So she's better able to manage her mental health, and she's taking steps towards reclaiming her children who were placed into foster care due to her circumstances when she was homeless. She feels that with support of the CAMBA case management staff, along with the security of having a home and the consistency of meetings with her therapist, she is able to have the platform necessary she needs to rebuild her life.
And so thanks, Erin. And so this is Lindsay again. I'm going to introduce you to the second development, Stout Street Health Center and the Renaissance Stout Street Lofts. And you'll see that there's a lot of really similar themes in the impact and in the problem that they're trying to solve here with this problem, as you saw in CAMBA Gardens. And so the Colorado Coalition for the Homeless is the developer of the Stout Street Health Center and Renaissance Stout Street Lofts in Denver, Colorado. And the coalition's mission is to work collaboratively towards the prevention of homelessness and also the creation of lasting solutions for the homeless and the at-risk families, children, and other individuals throughout Colorado. The coalition advocates for and provides a continuum of housing and a variety of services to meet the health, well-being, and stability needs of those that it serves. And their comprehensive approach addresses the causes of homelessness as well as other consequences of homelessness. So they're offering really critical assistance to more than 15,000 individuals and families each year. And so not surprisingly, there's a really strong demand for the coalition services. As we saw in New York, as in Denver, as housing costs rise, low-income renters are increasingly threatened by housing insecurity or homelessness. In 2015, there were more than 5,300 people estimated to be homeless in Denver, and there was a shortage of 18,000 affordable homes that were needed for the very low-income households, and those are households living at 50% of the area median income or below. The portion of Denver's residents who are homeless is actually higher than it was for that portion in New York City. So even though it seems like a smaller overall number, it's actually proportionally a very strong, if not kind of stronger need. And as you see in the charts on this slide, the homeless population, unsurprisingly, is comprised of vulnerable populations, including children, veterans, and those who are suffering from other physical and mental illnesses. The Coalition's Health Center has been present in the community for 30 years, but when demand for their services began to exceed the smaller space in the original location, the Coalition moved to a brand new health center, the development that we're talking about today. Enterprise's loan fund invested a little over $1.5 million in an acquisition loan, $1.3 in an acquisition loan to enable the Coalition to compete with the market in securing the land that was needed for the development. And Loan Fund also provided a $250,000 pre-development loan. Combined, this is a $1.57 million investment in this development to help bring it to fruition. The development provides supportive housing above the 53,000 square foot health center. The 78 units of supportive housing include 60 for formerly homeless individuals and 18 for low-income residents, making 50% of area median income or below, which for a family of 4 is about $38,000 per year. The health center also serves 13,000 patients each year. It provides medical, health care, primary care, dental and vision, Medicaid assistance, and a number of other services. And when developing the new center, the Coalition also updated their service delivery method to create an integrated healthcare system. So patients now, when they come to the new center, they can receive a physical, mental health evaluation, and a dental filling all in one visit, as an example. So this allows for better coordination of care, and it ensures that patients are receiving all the care that they need, even in one visit. And this is really significant for those homeless patients that are less likely to visit multiple doctors or make follow-up appointments to make health needs, because they can come into the clinic and get a variety of services and needs taken care of in that one visit that they're there. And so this integrated care model enables the center to provide the care that these patients really need. And they have a number of other supportive housing locations in the area, and so all of their residents, regardless of the building they live in, are eligible to receive health care at the center. And so now I'm going to hand it back over to Erin to talk a little bit more about the impact that we saw and what we heard from those residents and patients that are experiencing positive life transformation through this development.
Sure. So as Lindsay mentioned, we're going to see a lot of common themes here compared to what we saw in New York. And low-income households in Denver face the same challenges as those we saw in New York. They struggle to meet their needs with limited discretionary income after paying their rent. Such households are also more likely to have to relocate frequently in search of affordable rent or to live in unhealthy, overcrowded situations. This can be especially hard on children who experience negative health and educational outcomes as a result of frequent moves or poor housing quality. Like at CAMBA Gardens, many residents at the Renaissance Stout Street Lofts and the Coalition's other housing offerings receive individualized case management services. As a result of these services, which 60 households at the Lofts receive, and the affordable rents provided to all residents in the building, 94% of residents have remained housed since moving in, and 100% of families with children have done so. Moving on to the economic impact, again, like CAMBA Gardens, the development at the Stout Street, including the health center and the Lofts, has contributed to economic benefits for residents, patients, and the community. For example, on the resident side of things, with the assistance provided through case management, the number of permanent supportive housing residents reporting an income of less than $250 per month has dropped by 28% since move-in. For the wider community, the construction and operation of the health center has created over 300 jobs, and those are permanent, generated $6 million in local and federal tax revenues, and indirectly supports an additional 148 jobs in the community. When you include an estimated $1,263 reduction in public sector health costs per patient when they have coordinated care at the health center, including really important preventive care services, that equates to $16.7 million annually in savings for all patients. The total economic impact of the health center has been estimated to be $50.5 million every year. And I want to introduce you to Anne. Anne lives in the Lofts and also gets her health care through the health center. So she finds it really convenient, especially given her disabilities, that she lives upstairs and only has to go down a few flights to get to her health care. She was homeless for years, along with her husband and 6-year-old daughter. They were bouncing between shelters and low-cost motels, which was particularly challenging for their young daughter. She had special needs. She really requires consistency and stability to thrive. At the same time, paying several $100s per week at motels limited their ability to save or manage their finances. Now that they can afford their rent, more of Anne's husband's salary can go towards needed items, and Anne is able to focus on managing her disability and caring for her daughter. Both she and her daughter receive their primary care services at the health center, and Anne really believes the proximity has contributed to better overall health for both of them, since it's so easy for them to access services. They don't have to make long trips or plan ahead all that much. If they don't feel well, they can go right downstairs. She believes that the services at the health center have exceeded anything she expected, and her daughter really feels comfortable and trusts the doctors, which is, again, very important from her. She thinks that she benefits greatly from the genuine and kind treatment she gets at the health center, and Anne really thinks that the staff and health center radiate a passion for their work that promotes a very positive environment, especially for children like her daughter. In terms of health and wellness, the Stout Street Center really contributes to overall holistic patient well-being by utilizing that integrated care that we discussed already and a trauma-informed model. They've created a comfortable and welcoming environment for patients and improved their coordination of services. And by comfortable and welcoming environment, they really put a lot of thought into design. The building is very bright, lots of natural light. It doesn't have really an institutional feel like a lot of kind of clinics will have. And they also have a large courtyard outside so that patients don't have to wait in line on the streets. It really provides a refuge for patients as soon as they walk in. Since the new health center opened in 2014, the expanded space, capacity, and new facilities, they've all contributed to a significant increase in demand for the various specialty services provided at the center. This includes a 135% increase in patients seeking dental care, an additional 952 patients seeking mental health care services, and even a small improvement in the number of patients seeking vision care. Not only does the health center provide a comprehensive set of healthcare services, they do it really well. Patient health maintenance statistics and levels of basic care achieved match national averages in most areas and exceed them in many. For example, while 30% of asthmatic patients nationwide, and this includes patients of all income levels, have treatment plans in place, while 89% of those at the health center have the same. Young patients at the health center are immunized at higher rates than the general population. 78% of children at the health center have all of their immunizations on schedule, compared to only 71% nationwide. The health center also excels at ensuring pregnant mothers receive prenatal care early in their pregnancy, and that patients with high cholesterol are receiving treatment for that condition. It's part of the important preventive care that they receive. The health center also provides an additional supplemental services for patients in need, and that goes from assistance obtaining Medicaid between the 2014 and 2015, when they opened, to 1 year later. They had an additional 5,800 patients that had obtained health insurance. And this is really important for both the patients, who are able to now meet all their medical needs more easily, and the health center, who will never charge a patient for their services. So being able to have insurance cover some of that is really important for them. They also offer access to a pro bono legal clinic on a few days a week at the location of the health center, as well as domestic violence resources. So it's really a one-stop shop for a lot of the needs that their patients are facing. Now I want to talk about two of the patients at the health center. This first is Bobby. He was working as a certified nurse's assistant, and he really loved his job. He loved caring for other people. But in 2012, he got ill and experienced some complications arising from an infection related to his diabetes. He underwent several surgeries, but he was unable to keep up with the pace of his work, and he stopped working and became homeless within the space of a year. He's currently living in a shelter, and he's visited the Stout Street Health Center's vision clinic to obtain new prescription glasses. He's also visited their weekly legal clinic, and he appreciates the convenience of that offering. He believes that the work of the coalition is important for people like himself, who never imagined becoming homeless, but are now facing that reality. And for him, as someone who didn't really know what the services available to him were, being able to go to the health center and really find out everything that was available to him has been really helpful as he's navigating his new situation. And this final patient is Felicia. Felicia was living in Southern California, working at a daycare center as a preschool teacher when she became ill and received a diagnosis that she had fibromyalgia. When her medical needs became significant and her costs became significant, she stopped working, became uninsured, and really struggled to care for herself. She found herself in Denver at the invitation of a friend who is now her legal caregiver, who reached out to help her when she was at her lowest point. In Denver, the coalition connected her with housing of her own, where she has lived for several years, and she is receiving primary and mental health care at the clinic for more than 5 years. So she was a patient at the old clinic and has come with them to the new one. While it had been a challenge for her to obtain necessary medications prior to coming to the health center, she feels that the staff at the health center have treated her the way she's hoped to be treated, and she feels that they are helping her manage her condition better than some of her previous doctors.
Great, thanks, Erin. So as you all can see, really exciting stories of seeing the needs of these populations being met through these developments. As well, I think the stories also highlight the ongoing need, as there are still many people that need these supportive services and housing. But this gives you really just a snapshot of some of what we found in the research. We have the contacts up here for CAMBA as well as the Colorado Coalition for the Homeless. If you have any questions for them specifically about these developments and the work that they do, you can feel free to contact them. And now we'll take any questions. If you have any more questions for us, I think Donna will read those out to us. And just as a reminder, the full report has a lot more detail about what we found here, as well as references to some of the research that we utilized in our work.
Excellent. Thank you, Lindsay. Just a reminder that if you'd like to send us a question, type it into the Q&A panel, which is at the lower right-hand side of your screen, and we will be happy to take those. We already received a question of somebody who's looking for a link to the slides, and just a reminder that we will be sending, within 48 hours, not a link that will be not only to the slides, but also to the recording of the session as well. So that will be automatically provided to all of today's attendees. And let's see. Looks like I've got someone typing in, but I haven't gotten the full question in yet, so I'm gonna wait on that for a second. Oh, here's a couple. Does the loan fund only make loans in New York and Colorado?
So, Donna, this is Lori. Is my line still open?
It is indeed.
Okay, great. Thank you. So, no, we make loans nationally over the course of our time in lending, which is over 30 years. I believe at this point we've invested in roughly 46 of the 50 states, and our portfolio now is still quite national in its scope.
Okay, great. Thanks. Next question that came in. I'm interested in learning more about the cost savings and partnership with the ground lease. Can I contact CAMBA to learn more? If I have a similar project, can I contact Enterprise?
Absolutely. You can contact Enterprise in terms of learning about what we can offer to support you in that and how we structure financing. And I believe Lindsay said we'll include the additional information, contact information for the right folks at the project level.
Great. What do you anticipate the impact of the elections on our work in community development?
You know, at this point, we think that it is a bit too early to tell what that will be, and quite honestly, it can go a variety of different ways depending on which way the Trump administration decides to take things and what their relationship is going to be with Congress. So we certainly think that or planning for different kinds of scenarios, but we think that the opportunity for some benefits to come forward are just as great as some things that may require us to rethink how we provide financing and our approach to community development.
Okay, next question. I'm interested in making an investment in the impact note. Who is allowed to make an investment, and how can I find more information about doing that?
Yeah, so, and I'll ask Rachel to chime in if I don't cover all the bases with respect to that. Anyone is eligible to invest in the impact note. The minimum investment amount is $5,000. If you'd like to invest more than that, you will need to meet the accredited investor test with respect to that, and our website will help you walk through that process. In terms of who to contact, if I am getting all of the questions answered, it's Rachel Riley Carroll, and we'll certainly, to the extent that information is not readily available, we'll get that out to you all as well. You can also go through the enterprise website to get to that information about how to invest in the note.
Okay, the next question is, one challenge, especially for smaller organizations, is measuring the impact. Do you have strategies and/or funding sources to assist in measuring impact and possibly incorporating those measurements into regular operations?
So can I turn that over to Lindsay or Aaron?
Absolutely. This is Lindsay. I can take that one. And I completely agree. And honestly, it's hard even for large organizations to measure impact. I think it's something that everyone in the industry is really focusing on and trying to wrap their heads around more and more. And so you'll see even in this report, we used qualitative and quantitative information, direct kind of reporting from our partners on what they're doing, the services that are being used, some data from case management, as well as relying on kind of good, valid research that has been done in other instances. And so we, in these case studies, pulled together evidence from a variety of sources, which is, from a time perspective, something that I think smaller organizations can do if they're able to leverage some of their own reporting and the existing evidence base. That's certainly an option. But as we all know, there are a lot of instances where we really want to have kind of that ongoing measurement embedded into the work that you're doing. And Enterprise recently had an RFP out this summer for a demonstration project that we're working on. It's through a partnership with Success Measures at NeighborWorks America. And through that demonstration project, we are providing funding and technical assistance to 20 community organizations to measure the health outcomes of the work that they're doing. And through that effort, they're going to receive access to the Success Measures health tools, which are a set of validated health tools, survey instruments, and other forms that organizations can use in collecting health outcome data. So that RFP has already closed, but I would say stay tuned for future announcements of similar capacity building programs like that. Certainly the Success Measures tools are something to look into. They do require a subscription. I'm not sure of the fee. And they do have tools that are already out now that focus on community development and a number of different outcomes. And the health outcome tools are not made public yet, but they will be made public through this demonstration project. So not a direct answer to that, but I think this is certainly an area that Enterprise really values. We really want to help build the capacity of our partners, large and small, to measure the impact of their work. I would just say as one additional recommendation to really think about who your audience is and what evidence you really need to accomplish your work, and from that kind of back into what data you need to be collecting. Often in the haste to measure impact, we can sometimes try to measure impact on everything when you may need to only focus those efforts in depth on one or two programs. So that's certainly something that we always tell groups to think about at the outset.
And so this is Lori. Donna, before you move on, I just want to say I see now that Rachel's contact information as well as the website with respect to the note are still up on the screen for those interested in finding out more specifically of how to invest.
Sorry, some microphone problems. I'm going to reread that question. Has the loan fund worked together with grant programs for financing? Do you have examples of other partnerships with local level community groups and organizations?
So yes, again, this is Lori. We often work together with a whole host of grant programs as well as other financing sources. For those familiar with kind of affordable housing or community development in general, it is true about, the capital stack needed to bring these projects to fruition, and that can include grant sources. It could include other below-rate capital, sub-debt, equity, a variety of different sources to be able to get these through. And sometimes those dollars aren't always necessarily associated with housing. So, for example, in the Stout Street project, there was also funding from HRSA through their community facility grant program. So yes to that question. And then in terms of examples of other partnerships with local or with local level community groups and organizations, in addition to, again, federally qualified house centers and housing developers, we also work with educational programs that are looking to either deliver educational content or potentially start a charter school. We've worked with organizations who are focused on providing access to healthy foods. We work with groups that are focused on creating equitable opportunities for transit-oriented development. We've worked in Native communities. So, the list kind of goes on in terms of all of those stakeholders who are keenly interested in serving what we often define as a low-income population.
Great, thank you. Next question is, for the statistics and cost savings you cited in the presentation, where can I find that information?
Lindsay?
Sure. So for a lot of the information, you can find more detail in the report. And then in the report, we list the references and the sources where we pulled all of that information. So some of that comes from the organizations themselves, and some comes from other research, as I said. So you can go through the report and the 100 or so references that we have there and follow the trail of all the data that we have in the report.
Great. And you may have touched on this a little bit already, but just to go into a little more depth, the question is, does Enterprise do other work like this?
I guess I'm not sure what's meant by other work like this. I can talk a little bit about all of the work that we do, and maybe that we'll begin to incorporate it. So throughout the Enterprise family of companies, not only do we provide kind of this early pre-development and what we typically call but-for capital, but we also have the ability to provide capacity building and technical assistance services, can provide some grants to help support that with certain organizations in certain communities. We have programs that work on design through our Rose Fellowship program. We have programs that are focused on resiliency and bringing, equity with respect to energy savings and financing associated with that as well. We have a development company that develops affordable housing. We have, through that company as well, the capacity where when we see an opportunity that is there for us to ensure the long-term preservation of affordable housing, that we will, in fact, step in to acquire that property to ensure that long-term affordability piece. We have other kinds of funds that can bring actual equity to a project and to a developer in a community, in addition to the equity we provide on, arguably what's a subsidized basis through either low-income housing tax credits or new markets tax credits. There's a mortgage company where we help in terms of delivering the long-term permanent mortgage capital that is often difficult to find for these kinds of projects, particularly when they are small. Through our solutions group, we work with local government. There's an advisory group that works with local government specifically around how to make sure they are maximizing their access and their use of other federal programs, as well as to be thoughtful about programs that they could set up locally, locally being either, at a very specific kind of city or county level, as well as at the state level. And I'm sure I'm probably missing something in that mix, but if that's what you meant by that, I hope that that's answering the question. If not, certainly clarify and we can be more specific.
Excellent. Thank you, Lori. I am currently not seeing any other questions in the queue. Would any of our panelists like to offer some closing words for us?
Lindsay, Aaron, I don't know if you guys have anything more to add.
I think we're just about time, so I won't take too long, other than to say that we hope that this was as interesting for everyone as we found the research. And if you didn't catch the report that we did last year, very similar but focusing on different projects, you can check that out on the website. It looked at a few different housing and healthcare services as well. Okay, and then I would just add that, again, we are incredibly excited by the opportunity to continue to expand our ability to offer individuals an opportunity to invest in their communities through the Impact Note. We're certainly looking at options of how we create other funds and products to allow the same to happen. Something that I hope that we'll be sharing more broadly in terms of our work to look at impact and how we invest and opportunities to invest is something that, again, the Knowledge, Impact, and Strategy team is working on and will be launching called our Opportunity Index. And that's something that I'm particularly excited about because it will be quite informative to this work and our being able to tell our story in a much more robust way in terms of data and statistics of a then and now, if you will, and really just appreciative of all the folks who believe in our work and our ability and capacity to take their investment dollars and have impact in communities. So thank you all for joining us. Again, by all means, reach out to Rachel to the extent that you have any additional questions. And we look forward to staying in contact with you throughout the year with email blast and then next year's report.
Thank you, Lori. You've had the last word.
Okay, thank you, Donna.
Absolutely. With that, I'd like to say a big thanks to all of our panelists, both Lori and Lindsay and Aaron, and especially a big thank you to you, our attendees. We really appreciate you being here with us. And we hope to see you online again soon at another Enterprise Live Online event. Goodbye.